Welcome, welcome to the final Whiteboard Wednesday of 2020 from Advocates for Human Potential. Each Whiteboard Wednesday, we take a quick look at issues affecting public health and human services organizations and give you real-world solutions for real-world problems. I'm Kristen King, Director of Digital Strategy here at AHP, which includes everything from live social media events like this one, to webinars, to virtual classrooms, to massive online conferences, to strategic online collaboration, and more. Today, I am joined by two of my AHP colleagues. Patrick Gauthier is going to join me on screen in just a moment here. And Patrick is the director of AHP's Healthcare Solutions Division. He's devoted his career of 30 years to the behavioral health field, first as a provider and then as a managed care executive for more than a decade, followed by 15 years of strategic guidance to the field and as wide a variety of stakeholders. Patrick, thanks for joining us again.
Oh, thank you, Kristen.
You are so welcome. Now I'm going to add another colleague, Bonni Brownlee. Bonni Brownlee is a career healthcare consultant and quality management professional with expertise in program and systems design, healthcare operations and compliance, health service integration, performance management, change management, and health information technology integration, the whole gamut. And Bonni is a senior consultant here at AHP. Bonni, welcome to your first Whiteboard Wednesday.
Thank you so much.
You're so welcome. Today, we're going to be exploring tips for defining value of behavioral health services in the ACO environment. Value-based reimbursement, or VBR, as we may call it today, is where healthcare payment reform is going. And more providers are engaging in advanced alternative payment models like accountable care organizations that we've talked about many times that reward quality indicators rather than the volume of patient visits. So, Patrick, how do behavioral health providers play a role in helping organizations achieve those top quality scores and demonstrating the value that an organization is providing to their patients?
Kristen, I'm glad we're tackling that question first, because their role in demonstrating value is often unrecognized, and it has been for many years, nothing new. Of course, providing diagnosis and treatment to patients with mental health or substance use disorder diagnoses is the lion's share of what behavioral health providers do. That's to be expected. But the part that kind of flies under the radar is everything else that behavioral health providers do and can do. And that can be a lot. Things like providing behavioral health support to somebody with a chronic disease such as diabetes, or supporting a family with a child with an intellectual or developmental disability, or helping a person with cancer, trying to improve their quality of life.
Absolutely. If we want to see the real picture of behavioral health providers' contribution to the value of care, we really have to ask the right questions. And that means tracking the right metrics and defining the quality indicators that will prove our value.
This is great framing for our conversation. And before we go on, folks, if you're watching live, go ahead and give us a reaction to let us know that you're here. I also want to invite you to share questions and thoughts in the comments as we go through the live broadcast. You may see me kind of looking over to the side throughout the presentation today because I am watching for those comments and questions. So don't be alarmed if you see that happening. And for those of you who are watching on the replay, please feel free to leave your comments there as well, and we will respond in writing. So with that said, back to the conversation at hand. Bonni, so many providers struggle to find the right quality metrics and indicators that are going to demonstrate that value of the behavioral health services they deliver. Where should they start?
I think the appropriate starting point is with the foundational portion of their clinical care. Start with reviewing the evidence-based guidelines for the conditions that you're treating in your organization, health center, facility, or practice, and promote formal adoption of those standards so the clinical teams really begin to understand the clinical pathways and the ideal outcomes that we're seeking for our patients.
I really love the idea of starting with those existing standards for the tools and the interventions that you're already using, because that's such a great way to have immediate impact. Patrick, from that starting point, where would you go next?
Well, what Bonni just pointed to, and I couldn't agree more, is to start with the ideal, the recommended, right? That evidence-based practice lays out where people ought to be going on their journey, their path through treatment. And so I think the next step is to look at the actual clinical pathway that your patients are taking, and then compare that actual with what Bonnie's recommending, which is what is supposed to be happening. And that really requires the data, of course, that we've been talking about in all of these sessions. I think now we keep coming back to data, that I have to have the actual to compare to the standard, and to begin to ask some really critical questions. Are my patients moving through whole person care episodes the way they ought to be? And what outcomes or clinical quality indicators are associated with the route my patients are taking through their care plans? So let me give you an example to illustrate that. If the evidence base suggests that the ideal course of treatment is 8 treatments over a 2-month time frame, you, however, are regularly providing 4 treatments over a 3-month time frame, as evidenced by your own data, then you now know a lot more about your problem, your challenge, and how to improve your performance, how to improve your outcomes. Seeking out those nationally endorsed measures for behavioral health, like Healthy People 2030, the National Quality Forum, the American Psychiatric Association, those standards are going to be very, very important, as are the evidence-based practices. You take those, you combine them, and you start to get a sense of what it is you should be doing. You'll then look at your own data. You can see what you are in actuality doing.
Well, and this takes us to a really important point in question. I mean, Patrick just pointed out there's so many nationally endorsed metrics for mental health and behavioral health, or metrics and indicators for specific practices. Like Bonni said, you might have other indicators specific to your organization or to your payer. So Bonni, how do we prioritize these different metrics and measures that we could be using so we stay on track with what's really important?
That's an excellent question. So many organizations struggle with this very question. Review the list of measures that are currently being evaluated by the organization's quality improvement team. As a mental health provider or program director, are the measures applicable to your service? Are they relevant? Some may be, some may not be. Do the measures have an incentive payment tied to them by a payer, either now or possibly in the future? Is there anything that you are not measuring? Is there some important aspect of behavioral health care that could be measured but is not currently being measured? And mapping out these measures and how they line up with the actual practice is a process I like to call aligning the quality stars. And that helps us make sure that we're all on the same page across the organization with the many different priorities that we need to be accountable to. Organizations typically report on a fairly large family of metrics, 30 or so, and it's important to see how they line up and how they call us to be accountable. This, by laying out these quality stars, as I call it, that will help us set goals, develop processes for improvement, create workflows, build teams. It really is a central playbook for quality improvement.
Yes. Well, it brings it all together. And like we've discussed before, continuous quality improvement is not an individual event. It's not just something that like you do or I do. It really is a team sport. So when we're looking at it from that perspective, Patrick, what do we need to do to really approach CQI or continuous quality improvement and value in that way?
To me, it boils down to 2 words. Continuous quality improvement requires inputs. It requires action from each and every member of the team, not just those assigned to a QI committee. And I think that's what tends to happen very often is we say, well, that's the QI committee. That's their job. We'll let them worry about it. So word number 1 for me is collaboration. Collaboration needs to take place between your behavioral health program and your QI committee. And the second word is communication. Lines of communication need to be open between behavioral health and the director of nursing, the director of quality improvement, the chief clinical or the chief medical officer. It's surprising how often these parties are not communicating or collaborating, that they really see themselves as distant cousins, and that needs to be overcome. Frankly, behavioral health QI often requires overt special attention so that we can elevate it to the level of priority it really deserves in a general medical environment like an ACO. And yet, we know that behavioral and social factors contribute most to most forms of morbidity. So it's ironic that we have to work so hard to make behavioral health part of our overall QI program.
What would you add, Bonni?
Oh gosh, I love the concepts of collaboration and communication. And to that, I would add one more C word, and that is curiosity. Bring your curiosity to the QI committee and begin to develop a plan for measuring the value of mental health services. And by committee, I mean, it could be a formal structure inside your organization, your clinical practice, or perhaps it's at the health plan level that needs attention, or perhaps even at the ACO level. If you are a member of an ACO, work together to select metrics, refine the data definitions so everybody understands what you're looking at, confirm data sources, that sometimes can be a difficult thing, and develop reporting guidelines. What will the reports look like? How frequently will we report on certain metrics? And how will the information be shared across all stakeholders? If there isn't currently an incentive payment tied to your behavioral health metric or family of metrics that you would like to put forward, promote that idea to your ACO and or health plans to develop a pilot program which will lead to defined value for the behavioral health services that you provide.
I'm really hearing you both say how important it is for behavioral health program directors or managers to be really present at the quality improvement table.
Yeah, no, there's no question. As leaders and as members of the QI committee or initiative in your organization, you have to look at your own data and begin to identify the trends that concern behavioral health. And that, behavioral health has to help shape your inquiry, your analysis. Encourage then real action planning. We've identified a trend. We can see this in our data. Now we need to develop a real plan to improve our services or the access points, where people are going to be able to access those services, might be the emergency department, for example, and the outcomes that are directly and indirectly impacted by behavioral health. Both are very important, the direct and the indirect. And then a fourth C word, celebrate your successes along the way, really recognize people for this hard work.
Yeah, well, and it really is hard work, isn't it? So we want to have that celebration because otherwise, sometimes the data lags, right? We don't always know what the impact is immediately, but by celebrating the steps in that direction, it really can help to keep folks motivated and on track and really understanding what they're building to. And before we go on, I want to just highlight a comment that came in from one of our live viewers. This person is saying, I wouldn't have thought of curiosity, but that is what leads to innovation. So we got some really, really good C words today. So let's talk about some next steps. Bonni mentioned this idea of aligning the quality stars. And I know that you all created a tool to help our audience with this exercise. So I'm going to go ahead and pull that up on the screen just so you can get a snapshot. I know you're not going to be able to read it super well, but we're going to give you a link to download it in a second. Bonni, can you explain what this tool can do so folks get a sense of what this is?
Yeah, this is a matrix that will help lay out anything and everything that you might be interested in measuring. A completed matrix will tell you really what is important to whom across this spectrum that you see represented here. I've populated this sample with some behavioral health metrics in a few different categories: clinical preventive, clinical acute, and clinical chronic, for example. And in the center are 4 nationally recognized standards bearers, including the National Quality Forum and the American Psychiatric Association. You might want to take a look at other nationally endorsed standards and add others to this matrix as you begin to start to develop this. But you'll fill in the blanks relative to your organization. What are you reporting at the federal, state, and local levels? What are you reporting to health plans or to national initiatives with or without a financial incentive? And then one important step that I didn't have a checkbox on here for is, do we have a data source for these metrics? That's an important determining point. You can then select metrics that are relevant to your organization, those that create efficiencies through your crossover reporting potential, and you can also examine or even project incentive payments based on what you've selected to report. So I hope you find this as a useful additive to your quality work.
Thanks, Bonni. Anything to add, Patrick?
Yeah, it's a great tool. Bonni did a fabulous job with it. And I think what I would encourage folks to do is to think of it as a strategic tool in a sense. It's also very practical and tactical, but strategic in the sense that you get to think about it in terms of, what do our payers expect? What do our contracts require in terms of quality? And then what do we, perhaps as a leadership team or our board of directors, what do we expect? And there's going to be some overlap between the two, but you'll certainly come up with some strategic measures that are a reflection of your mission, your vision, your goals and objectives, and then there'll be measures that are a function of your contracts. So use that opportunity to address this both strategically and tactically for the payers and contracts, your partners, as well as your own vision, mission, goals, and objectives.
Thanks, Patrick. Thanks, Bonni. So this matrix, folks, is available free from our website. I am dropping a comment with the link into the live broadcast now, so it's also available in the Facebook replay. Those of you watching in YouTube, you'll find it in the video description. So let me go ahead and make our cameras a little bit bigger again. Folks, we really do want to encourage you to grab this tool, keep it handy, use it to support your quality efforts, and help you really demonstrate that value in your organization. And of course, Patrick and Bonni are always available for a consultation if you would like some additional support. Any closing thoughts, Patrick, Bonni, before we wrap up? Anything that you didn't get to throw in that you want to add?
I'll throw in that I want to wish everybody a very healthy and happy closing to the year 2020, which will stand out in all our collective memories, I'm sure. It's a very challenging year, and I wish you all a very happy and healthy and prosperous new year.
Thanks, Patrick.
I echo that.
Great, thank you. All right, Patrick, Gauthier, Bonni Brownlee, thank you so much for spending your lunch break with me today to talk about defining value of behavioral health services in the ACO environment. And thank you to all of you for joining us. We will be back in 2021 with more live content featuring more of AHP's in-house experts and thought leaders to answer more of your questions. So if you would like to request a topic for us to cover in one of these Facebook Lives, please email us with those ideas. I am going to put the email address into the comments right now. And we would love to receive your ideas and your thoughts and your questions. So with that, on behalf of my colleagues and my digital strategy and online events team here at AHP, I'm Kristen King signing off until next year. We will see you in 2021. Bye now.